This is Janice Lopez from the International Organization for Migration, and welcome to the Migration Health Research Podcast. This issue of the Migration Health Research Bulletin number 18 profiles recent publications around IOM's global migration health assessment activities, psychosocial counseling, and health information management in Europe. Further, this issue showcases book chapter, blog posts, commentary pieces, methodology paper, and research articles which cover topics ranging from COVID-19, tuberculosis, universal healthcare, and migration health research and policy. For this audio podcast episode, we feature an interview with Dr. Olga Gorbacheva, Migration Health Division's Global Coordinator of its Health Assessment Program, based in IOM Headquarters in Geneva, who will talk about the importance of following an evidence-based approach in the implementation of tuberculosis management within the IOM's Migration Health Assessment Program. Let's listen to Dr. Olga Gorbacheva.
In the migration context, tuberculosis detection and control continue to be an important public health concern for both sending and receiving countries, as well as migrants and their families. IOM provides pre-migration health activities for refugees and migrants at the request of the receiving country governments, many of which include tuberculosis detection and management as one of the main requirements within their protocols. And accordingly, IOM provides a wide variety of tuberculosis-related services ranging from diagnostics to treatment, including public health measures such as contact tracing and health education. In 2019 alone, IOM detected 622 active cases and provided treatment to 380 TB patients. The rest referred for treatment to the national TB programs. In this context, the TB manual is a very important tool to provide guidance to the IOM migration health physicians, nurses, laboratory technicians, and other staff working in migration health assessment programs as to the key components and methodologies for identifying and then managing beneficiaries with tuberculosis to ensure that each beneficiary receives evidence-based and state-of-the-art assessment and, if necessary, treatment. This global tool is meant to be used in conjunction with the country-specific standard operating procedures and algorithms that IOM missions are developing. The manual also emphasizes that in the context of the pre-migration health activities, IOM should adhere to technical instruction of the receiving countries. However, it also provides a bridge between the technical instructions and external guidelines.
What are the key points from this publication that you want to share with the public?
It is difficult to single out the main points from the manual itself, as it encompasses a wide spectrum of issues surrounding the care of the TB patient. I already mentioned that it includes screening algorithms, interpretation of the laboratory results, counseling, contact tracing, treatment, psychosocial support, reporting, and infection prevention and control. All aspects described in the manual are equally important and must be implemented without exception if we want to have a successful management of the TB program. I would like, however, to convey the following message. The document addresses many issues specifically related to the context of the pre-migration health activity. It also synthesizes and makes reference to a number of national and international guidelines. And from that point of view, the manual may be interested not only to the IOM health professionals, but also to a wider audience of professionals and public health specialists involved in organization and provision of the TB care. As you saw, we referenced only recent guidelines, and it also means the manual is a living document and will be updated as the new guidelines emerge.
How will it contribute to the process of tuberculosis management for IOM health assessment activities worldwide?
Quality of the TB management requires the consistent and diligent application of a standardized, evidence-based approach. This manual is to support a consistent and high-quality process of TB management for IOM health assessment activities worldwide. The management of tuberculosis has two overall objectives. The first one is to adequately treat and cure the infected patient. And the second one is to minimize the risk of transmission to other persons before, during, and after migration. And from that point of view, it is expected that this manual will help IOM staff to manage public health risks, including infection control, contact tracing, ensure evidence-based, and I would like to emphasize, patient-centered management of TB. It will also help us to conform with the resettlement countries' technical instructions and a wider range of recommendations. And it will provide a tool for harmonization of the IOM programs, tuberculosis management programs, with the host country national TB programs. Finally, I would like to say that this manual does not replace clinical judgment and does not prevent physicians from performing additional investigations or taking clinical actions as individual cases require. A standard approach cannot cover all possibilities, meaning that the exception will arise. However, this doesn't undermine the importance of consistency as a foundation for quality of TB management.
Thank you very much, Dr. Olga, and thank you all for listening. Please feel free to share feedback with us. See you on the next podcast.